was one.
Yeah.
They stuck me on the end for a reason, no doubt. You know, I've debated heavily on how I wanted to present this information to you today. And I'm glad that we're sitting. I get much more nervous, I think, as I stand, and I tend to pace. Let me just first tell you two things. First of all, I'm happy to be in Wichita, born and raised here, and it's good to be home. The second thing is, apparently, my life is worth about $2 million. I say that to you honestly. That is what my health insurance company has paid for in the last several years when I was diagnosed with breast cancer. We don't live in a different country. We live in America. And in America, I need to say this right off the bat, and then I'll kind of read my thoughts. I don't see in my lifetime us ever putting a value on someone's life at $45,000. I think it's important that you hear that. I also think it's important to say to you, I don't think that Obama is sitting up in DC with death panels waiting to kill off our senior citizens. Now for the advocate view on this. I was asked to address two issues today, two simple issues, access and affordability. Kind of no-brainers, right? For those of us who are fortunate enough to have health insurance, they really are no-brainers. To address the issues, we must first consider that our United States, our health outcomes are mediocre at best compared to other industrialized nations. We spend about 30 cents of every dollar on health care that is unnecessary. The current system is unsustainable the way it is. I'm truly worried about when I'm 60, what's going to happen if we don't fix this, since we've waited so very long to address it, since the Clintons were in office. Clintons, no. The high cost of health care, as I see it, is the primary barrier to getting access. In 1999 to 2008, if you can believe this, health coverage premiums increased by 119%. However, here's the bad news. During that same time, wages only increased by about 29%. Again, a no-brainer. High deductibles, co-pays, co-insurance are additional barriers to getting health care in this country. Obtaining health care is even more difficult, almost impossible, if you don't have employee-sponsored health insurance. In Kansas, we spend an average of $11,200 a year on the individual market, compared to people who are employee-sponsored healthcare enrollees who spend about $5,600. People are being forced to make very tough decisions right now. I'm sure that you all know people, you may be people. I at any given month am one of those people who am forced to make the impossible choice between putting food on the table and buying healthcare insurance. Choosing between the necessities of food, shelter, and your health is really no choice at all. What people don't realize is that most uninsured Kansans are working, and they are Kansans who are also losing their jobs. Right now, 350,000 people are uninsured in this state, and that is 13%. That has increased 1.5% since the last census data. And it's sure to go up, and that was before the recession. The percentage of unemployed Kansans has doubled. Many of those unemployed workers have lost their health care coverage and cannot afford COBRA. Many of you probably know COBRA is outrageously expensive. Who in the world can afford $1,500 a month? According to a recent study actually that was just released, 320 Kansans are losing their health coverage every week, with a staggering 16,620 losing coverage every year. Many uninsured Kansans are denied health insurance due to pre-existing conditions. Just as a sidebar, I have Blue Cross. When I moved back to Kansas after having breast cancer, Blue Cross did everything that they could possibly do to not insure me. They didn't want me. They still don't want me, but they're insuring me. You know, the pre-existing condition it's a huge issue. I don't know anybody these days who's at least my age who doesn't have something wrong with them that they could include as a pre-existing condition. The individual market can refuse coverage to people, and again, that's where I was denied. With a pre-existing condition, or they can make premium costs so outrageously expensive you cannot afford it. Blue Cross had quoted me in the individual market about $1,260 a month, and that was in the individual market. For those who claim that any national health reform is a rationing of care, I suggest that they look at the rationing of care that is already happening with the denial of coverage for those people who truly need it and are very sick.
Yes.
The status quo limits care for consumers right now and eliminates care altogether for many. The health reform package must include some kind of alleviation for the burden of medical debt. Medical debt is fast becoming a problem for the middle class like we've never seen it before. It used to be a real line was drawn between the haves and the have-nots. I would encourage you to think that that line is narrowing. I used to consider myself a have. I could very easily be swayed into the have-nots. Healthcare costs are bankrupting the middle class. This is no longer a poor person issue. The middle class could, and they did. I think that my family did when I was growing up. It was a poor person issue. They felt badly about it, but they were poor. The healthcare costs, right now, this is an issue affecting all socioeconomic groups. And currently, as the first doctor had said, over half of all bankruptcies have a medical debt contributing factor. Contrary to popular belief, medical debt is not necessarily the result of being uninsured. Think about this. 75% of all medical debtors had insurance at the onset of their illness. Kansans with the least ability to pay are being charged full sticker price for healthcare services.
Yep.
Doctors and hospitals often demand full payment within 90 days. If the bill is not paid, you probably know someone like this, then they turn it over to collections, thus ruining a family's credit history. Patients are often encouraged to charge their medical bills to high-interest credit cards, apparently now handed out at any doctor's office, dentist office, eye doctor, or hospital.
Yep.
As consumers accrue medical debt, they forego care. Again, that's a no-brainer. They're not going to get care. I have foregone care because I don't want to rack up in co-insurance a medical bill. No one can afford to get sick. No one can afford care. As I see it, we are one illness away, all of us, from going bankrupt. For me, the bottom line is this. For Americans, I see health care as a right, not a privilege.
Woo!
Just because a person is less fortunate than those of us in this room and make less money, who are we to say that they should be denied access to care?
Thank you.